During Hurricane Milton, we had to evacuate all the patients in the hospital. We were fortunate enough to be able to transfer our transplant services to Northside Hospital. We have over 400 patients on our list.
But you have this wait list of patients that have an established network of physicians, the social workers, essentially their care team that they've been on this journey. The program can't continue. That wait list has to go inactive. They would essentially have to restart.
Patients in need of a transplant, they either get a transplant or they die. And so they put their faith in us, and that's something that we don't take lightly.
After the hurricane, we came up with the idea of, we could really relocate this program to Northside, and we could provide uninterrupted care to these patients.
All our equipment and all of our transplant staff from the operating room, from patient care areas, intensive care unit, and all the physicians and nurses all came over and started practicing transplant surgery.
Transplant programs have relocated before, but I think it's unprecedented that the program never had to really shut down and was relocated in almost a week.
People on the kidney waiting list may wait 2, 3, 4 years sometimes for a transplant. The sickest patients on the liver list get the next available liver, and our one patient that we've been able to transplant here was the sickest person on the list at that time.
My name is Jennifer Miller. I was on the list. I needed a liver. I got the call and they said I needed to go to Northside, and I was the first patient.
Jennifer was our first liver transplant we did here at Northside.
Every nurse that I had, they told me we came from Largo, so that made me feel comfortable. I had the best experience. I went into the surgery. Next day I got up and I walked. They were there for me to get me back on my feet.
Normally it takes 2 weeks after you get a liver transplant to get out. She was out in a week.
The team at Northside has been just very gracious to accept us and to pitch in and become part of the transplant team.
It's going well because of the people. It could not be done without the people at Largo and the people here at Northside and their commitment to making this happen. To take such a complex program and mesh two cultures together so that these patients can get the care that they need, it is truly a remarkable event.
They were so good to me, and this is why I'm sitting here today. I think I have a chance at a new life thanks to them.